Hello, my name is Billy Williams, Medicare Health Insurance Options. In this video, we're going to talk about Medicare and the choice of doctors. Being able to choose a specific doctor is very important to most of our customers. This also includes the ability to change your primary doctor or change a specialist if you need to. So how does all this work? Do you have the flexibility to change doctors, to choose a new doctor if you need to? Hopefully this video will help clarify this issue for you. The specific answer to this question is going to depend to some degree on what type of insurance coverage that you have now. You might have Medicare only. You may have some type of a group health plan. You might have Medicare and a Medicare supplement policy, or you also may have some type of a managed care, some type of a network policy, more commonly referred to as Medicare Advantage. We're going to go through each of these and explain the process depending on what type of coverage that you have. If you're over the age of 65 and still working and you still have a group plan, this most likely will be some type of a network plan. In this situation, you will need to either get a list of doctors from the insurance company, or if you have the name of a specific doctor that you would like to start seeing or change to, you can simply call the doctor's office and explain to them what type of coverage that you have and ask if they take that specific plan. You most likely will need to speak with someone in the insurance department at your doctor's office. Many of the people that we talk to that are on Medicare, getting ready for Medicare, do decide to get a Medicare Advantage plan. There are two basic types of Medicare Advantage plans. The first one we're going to talk about is an HMO. An HMO is a rather strict network. This situation requires you to have a primary doctor who does have a contract with the insurance company that is running the Medicare Advantage plan. Your primary doctor is going to be the one that you have to see first before you can receive a referral to see a specialist. So if you have the need to change doctors, you will need to speak with the insurance company to change your primary doctor. And then if there are any specialists that you want to see, you will need to also call the insurance company or call the doctor's office to see if they take that specific plan. The next type of Medicare Advantage plan that we're going to talk about is a PPO. This is also a network plan, but it is not as strict a network as an HMO can be. On a PPO, generally speaking, if the medical provider that you want to see will agree to send a claim to the insurance company, they will receive payment for their services. Keep in mind, in a PPO, there normally is a network and also out-of-network charges. So if you go to a doctor that is not in the PPO network, it might cost you more. Again, the advice here is the same. Contact your insurance company. Also call the doctor's office. Ask them if they do take the specific plan that you have or the plan that you're thinking of changing to. The next situation we're going to talk about is if you have Medicare as your main coverage and you have enrolled in or are thinking of enrolling in a Medicare supplement policy. These plans are sometimes also referred to as Medigap plans. In this type of situation, you're going to have the most flexibility. The only thing that you have to ask any medical provider is, do you accept Medicare? If the hospital or clinic or specialist or doctor does agree to accept Medicare as the main coverage, then your secondary Medicare supplement will also be covered as well. There is a way to check this on the Medicare website. I'm going to switch over to my computer and show you a brief example of how you can use the Medicare website to search for a doctor to see if they do accept Medicare. This is a brief tutorial on how to use the Find Care tool on the Medicare.gov website. So you can see here we're at the Medicare.gov website. We're going to scroll down in the middle of the first home page and click on where it says Find Care. Now you can see here you can search for a lot of things: doctors, hospitals, nursing homes, and etc. The purpose of this tutorial is to show how you might use this tool if you were needing to change doctors. One case would be this name of the doctor that you want to change to. This tool will help you determine if that doctor does take Medicare, or you may simply be moving to a new area, you need a new doctor, and you're looking for primary care physicians or specialists in a specific area that might provide providers to you that would be good for your needs. In this example, we're going to assume that we do know the name of a doctor. We're going to click on doctors and clinics, and we're going to put in Dallas, Texas as an example. We're going to put in the name of a cardiologist by the name of Melissa Carey, and do a search, and we didn't even hit the search button, and there she is. So this brings up all of the information on this individual. One important piece of information here, if you can see where it says general information, Medicare approved payment, accepts Medicare approved payment amounts. This means that they do accept assignment, which means they do accept Part A and Part B of Medicare. So this is just a brief example of how you can use the Find Care tool on the Medicare.gov website. Welcome back. I hope that information was helpful. As you can see, there is a way to check on the Medicare website to see if a doctor does accept Medicare. If they do accept Medicare, they will accept your Medicare supplement. It is, of course, also possible for you to call a doctor's office and ask them if they accept Medicare, and they should be able to easily tell you that. I don't think you're ever going to find a hospital that does not accept Medicare. There is a possibility that there are some doctor's offices that either don't take Medicare or are not taking any new people on Medicare, but that is a very rare case. So I hope this information is helpful. I think in most cases, if for some reason you do need to find a new doctor, you are going to be able to, in most cases, find a doctor or a specialist that will take the coverage that you have. In some rare cases, it might be necessary for you to change your insurance to make sure you can either keep your doctor or change to a new doctor that you feel is the best for your specific needs. If this is the case, please give us a call. We would be very happy to take a look at your specific situation, depending on where you live, what type of doctor that you're trying to go to, what type of insurance that we might recommend that would be the best coverage for you based on those specific situations. My services to you are always free. I have been in the Medicare space for over 10 years. This is my specialty. We can work with you with your Medicare coverage, with your prescription coverage, and if you have any questions, please do not hesitate to give me a call. Again, my name is Billy Williams. Our website is MedicareHealthInsuranceOptions.com. We look forward to speaking with you in the near future. Hope you're having a great day.